Hello and welcome to Medical Dialogues. I'm Anshika Mishra, hairspray to you from the world of medicine. Are antibiotics effective for lower respiratory tract infections? According to a study published in a journal of General Internal Medicine, use of antibiotics provided no measurable impact on the severity or duration of coughs, even if a bacterial infection was present. Upper respiratory tract infections like colds, sore throats, and sinus infections have clear antibiotic guidelines. Lower respiratory infections, including pneumonia, affects 3 to 5% of patients and often prompt antibiotic use due to limited access to X-rays and patient expectations. However, symptoms relief and time typically resolve most infections, says the study's lead author, Dan Maristy. In the study, researchers prescribed antibiotics to people who sought treatment for urgent care settings for lower respiratory tract infections. They used advanced lab tests to identify bacterial or viral infections, categorizing them as bacterial only, viral only, both viral and bacterial, or no organism detected.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Is consuming legumes linked to better nutrition intake in toddlers? A recent study published in the journal Nutrients discussed improvements in diet quality associated with legume consumption in young children. Early childhood nutrition impacts an individual's development and both acute and long-term disease risk. Legumes are widely known to be excellent source of protein, carbohydrates, micronutrients, and phytochemicals. Few studies have assessed the benefits of legume in early childhood diets. Current recommendations advise that toddlers and children consume 1.5 cups of cooked legumes each week. For the study, researchers analyzed legume intake and overall dietary intake from both 24 months using data from the Women, Infants and Children Infant and Toddler Feeding Practices study. They gathered data from approximately 3,000 mother-child pairs. The study aimed to quantify the consumption of dried beans, lima beans, chili, and yellow beans in grams as a percentage of total dietary energy intake. Micronutrient intake was assessed at 11 and 24 months. Does GLP-1 drug affect thyroid cancer risk? A study published in the journal The BMJ found no significant increase in thyroid cancer risk for people with type 2 diabetes on GLP-1 agonist compared with people treated with DPP-4 inhibitors. Glucagon-like peptide-1 receptor or GLP-1 agonists are an effective treatment for controlling blood glucose level in people with type 2 diabetes, particularly those who do not respond or stop responding to first line of treatment such as metformin. One concern about the medication is that some studies suggest they may increase the risk of thyroid cancer. However, these studies point out that the health benefits of the drug are likely to outweigh this increased risk. The study used data on more than 1,45,000 people treated with GLP-1 agonist and almost 2,92,000 people treated with DPP inhibitors. The researchers follow up participants after a mean of 3.9 years for the GLP-1 group and 5.4 years for the DPP-4 group. They identified cases of thyroid cancers from nationwide cancer registers. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.